Hi friends, in this video we shall discuss about osteochondritis dessicans. A male patient in between age group 15 to 18 came to OPD with aching pain and recurrent effusion. This is the clinical presentation of osteochondritis dessicans, and initially there won't be locking. But in the later phase, when this particular piece become a loose body, then there will be locking. Locking means extension, absence of extension. Extension is arrested. The last 30 to 40 degree extension is absent due to locking. That is the symptom. Locking actually the word meaning in knee joint locking means absence of extension. Last final extension is arrested due to this loose body. It may also occur in meniscal tear, mainly bucket handle tear. Coming to this particular condition, osteochondritis dessicans, this is occurring due to the continuous impingement of medial femoral condyle in between tibial spine and cruciate ligament. This is the reason for osteochondritis dessicans. That particular piece of bone becomes avascular and there will be a demarcation in between the unhealthy bone and healthy bone. The most common site is medial femoral condyle, very near to intercondylar notch. This is the site. And the reason is continuous impingement or strain with tibial spine and cruciate ligament. Due to that, there will be avascularization of this particular piece of bone. And here in X-ray, you shall see a demarcation in between the healthy bone and unhealthy bone. This is in the initial phase X-ray. And in initial phase, the presenting complaint is aching pain with recurrent effusion, and most commonly males are affected, and it is affected in the second decade. Here we shall able to see loose body, and whenever there is loose body, then locking will be there, absence of complete extension will be there, and in that particular condition, this loose body shall to be excised, and that is the treatment protocol. But here in this particular phase, we shall advise the patient to do quadriceps strengthening exercise with proper weight bearing. With weight bearing is very important before the age of complete epiphysis. Weight bearing and with quadriceps strengthening exercise will give result in osteochondritis dessicans. And the clinical examination of osteochondritis dessicans is Wilson's test. In Wilson's test, complete flexion of knee is to be done either in sitting or supine posture. In complete flexion, passive internal rotation of foot should be done by the examiner, and then extension is done. In complete extension, patient felt pain over the medial femoral condyle due to the internal rotation of foot. Whenever the internal rotation of foot is removed to neutral position, then that pain will be subsided. This is the Wilson's test. First one is flexion of knee joint, then passive internal rotation of foot, and in passive internal rotation of foot, extension of knee is done, which causes pain over the medial femoral condyle, and relief from that particular position. Whenever the internal rotation is released, at that moment itself, pain will be subsided. This is Wilson's test. And in the initial phase, we shall also include the prayoga of Laksha, Maduga and Leshuna. Each 10 gram as Palkashaya is very effective in the initial phase management. Whenever it becomes a loose body, it should be excised and surgical reference is needed. Before that, in this particular stage, by giving Laksha, Maduga and Leshuna, 10 gram each as Palkashaya is effective with quadriceps strengthening exercise and weight bearing. Hope you understand osteochondritis dessicans, the clinical examination, presenting complaint, and management of osteochondritis dessicans. Thank you.